My name is Samantha Shenoy, and I'm a nurse practitioner at the University of California in San Francisco, and I work with patients with multiple myeloma. And today I'm going to be speaking with you about the long-term follow-up results from the CARTITUDE-1 study. So CARTITUDE-1 was a phase 1b/2 study that led to the FDA approval of ciltacabtagene, which is a B-cell maturation antigen or BCMA-directed chimeric antigen receptor or CAR T-cell therapy in patients with heavily pretreated relapsed refractory multiple myeloma. So eligible patients in this study had to have progressive multiple myeloma. They had to have received greater than 3 or more lines of therapy or were double refractory to a proteasome inhibitor and an immunomodulatory drug, and had received a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 antibody. So long-term follow-up from this pivotal CARTITUDE-1 study was presented at ASCO in early June of this year and was also presented at EHA, and showed that at a median study follow-up of about 61.3 months, 1/3 of these patients, so 33% of these patients, remained alive and progression-free for 5 or more years after a single cilta-cel infusion. Now, these patients did not have any maintenance treatment, and they were also not treated with any other myeloma-directed therapy. So this was a one-and-done CAR T-cell infusion. So this is a really remarkable result. And with longer follow-up, they also found that half of these patients were alive for 5 or more years. And so when we think of historically patients who were heavily pretreated, relapsed refractory myeloma patients, they historically have an expected median progression-free survival of less than 6 months and a median overall survival of about a year. So for the 97 patients in this study, the median overall survival was 60.7 months, which far exceeds what we would expect for this group of patients. So this is unprecedented. And I also wanted to note that 12 of these patients at a single center, they had serial MRD testing, or so this is minimal residual disease testing, and they had PET-CT assessments. And all of these patients were 100% MRD negative, and their PET-CT assessments were also negative at year 5 or later after receiving cilta-cel. So this data really suggests potential for cure. And again, this is showing an unprecedented durability of complete response. And one thing that I found really interesting is that when you look at the baseline characteristics of those patients who remained alive and they were progression-free for 5 or more years versus those that relapsed within 5 years, there was a similar number of patients who had high-risk cytogenetics in the two groups. And there was also a similar percent of patients who had extramedullary disease. So this is when myeloma grows outside of the bone. And so what this suggests is that these high-risk features at baseline don't necessarily predict who's going to be progression-free and alive. So, I talk to my patients, and so who have high-risk disease, and I talk to them about these results and let them know that the potential for long-term remission in these patients in the CARTITUDE-1 study was not limited to patients with standard risk disease, and so patients with high-risk cytogenetics and those with extramedullary disease were equally likely to be progression-free. So that's a really important and interesting result. Another interesting thing they looked at is they did some correlative studies, and they found that patients who had a more immune fit CAR T product appear to respond longer. And, they also found that patients who had a lower baseline tumor burden also tended to respond longer. Another important thing that I wanted to mention is that when they looked at the safety profile, they found that the safety profile of cilta-cel remained consistent with previous reports. So with this longer follow-up in these patients who were progression-free for more than 5 years, there was two patients who had new secondary primary malignancies. Those were both solid tumors, but they were not attributed to cilta-cel. There was also 2 neurologic events that were also not related to cilta-cel. And then there was only 4 grade 3 infections that were also not attributed to cilta-cel. So, and notably also, there was no new cases of Parkinsonism or cranial nerve palsies that were reported. For oncology APPs who work with patients with multiple myeloma, it's really important to be knowledgeable about this long-term data from the CARTITUDE-1 study. And it's really important to educate our patients about this really impressive data. I was just at a multiple myeloma support group and talking with patients about, I was talking to a wide range of patients who are newly diagnosed versus patients who had been getting myeloma treatment for a longer period of time. And when patients are first diagnosed with myeloma, of course, their world is turned upside down. It's really scary. It's really overwhelming. And I think when we can give patients hope and talk to them about something like the CARTITUDE-1 data that's so impressive, I think it really is important because it gives patients hope. It gives them, lets them know that there's therapies out there that they can benefit from long term. I also was talking with one of my patients who told me, when I was first diagnosed, and he's somebody who had who was on the CARTITUDE-1 study, he'd said, I had, when I was first diagnosed with multiple myeloma, my biggest hope was that I could see my kids get married. And now we're talking, and not only has he seen both of his kids get married, but now he's expecting his first grandchild, which he told me he never thought he would expect. So he never thought he would get to see, sorry. So I think, again, just sharing some of these results really gives our patients hope. I think sharing some of the long-term safety profile data that I just mentioned is also really important. Also, as an APP, we do a lot of toxicity management, and really the toxicity that we see with these therapies are, it's easy to manage. And I think the other thing that I want to say, I've been working with patients with multiple myeloma for over 15 years, and 15 years ago, we didn't have this type of therapy, and we didn't get to, share these really impressive results with patients. And so, and the prognosis was much more dismal for patients 15 years ago. So I think it's really important that we share this with our patients, again, to give them hope, to know that there's therapies like this out there. So one of the things that I wanted to emphasize is that this was really a one and done therapy. So where patients remained in remission for more than 5 years after a single cilta-cel infusion without maintenance. So the reason why this is so important is because these patients could return and back to their regular lives and have some normalcy to their lives, go back to work, travel, do all the things that make them who they are. And they could do this because they didn't have to keep coming back into our center to keep getting treatment. So I think one of the most important things to communicate with about these long-term follow-up results from CARTITUDE-1 is that these patients were treatment free after this therapy. And so it really allowed them to live their life and, do the things, again, that make them who they are and not feel like they had to come into the center weekly or every month to continue to get treatment. In addition, I just wanted to say that, these CARTITUDE-1 results, it's really the longest study follow-up after any CAR T therapy in multiple myeloma, along with LEGEND-2, and it really shows the first evidence of curative potential of cilta-cel. And again, with a third of these patients remaining treatment-free and progression-free after 5 years, for 5 years after a single infusion. And again, just want to highlight that the toxicity profile for cilta-cel is very manageable, and we're learning more and more about how to better manage and predict some of these delayed neurotoxicities. I think the one other thing that I would highlight is an APP, we are usually the ones that are doing the in-depth teaching with patients about the therapies that they're receiving. So as an APP, it's really important to be knowledgeable about this data, to share it with your patients, and to reassure them. Because, when we see patients in clinic, we know there's so much anxiety, whether it's a new diagnosis or someone who's further along their treatment journey. And so I think when we share this data, it can really help, again, give patients hope, help address some of that anxiety that we're seeing these really impressive results, and that, give them the hope that they'll be able to go back to living that life that they had before they were diagnosed.